Good evening and welcome to Inside Government for the spring 2014 semester. This is a show produced by KU Community College. 2 weeks ago, a great deal of media attention across the nation was assigned to the death of actor Philip Seymour Hoffman from a heroin overdose. The rise of heroin deaths in the nation has also been matched with the increase in overdose deaths by opiates, often commonly thought of as pharmaceuticals such as Oxycontin, Vicodin, and Percocet. Upstate New York and KU County has not been immune from this scourge of heroin and opiates, as well as related deaths to them. Two high-profile deaths occurred last fall. On Tuesday night, it was announced that the KU County Sheriff's Department was concentrating on the use of heroin with a new effort. Heroin had, according to some reports, largely disappeared after the Vietnam War and by the 1980s, but it has all of a sudden reappeared and made a deadly resurgence. For example, heroin-related calls to Upstate Medical Center are up some 417% in 4 years. Still, the growth of opioids killing Americans is 5 times the rate of heroin. Part of the issues related to the growth of this abuse is what people do with non-used pills. Addicts trying to find doctors who will easily prescribe for them, called doctor shopping, and the issue related to pill mills from Canada that dispense pharmaceuticals across the border. The crisis has seen a decline in some cases of opiates, while heroin has increased, and then vice versa. It's a tandem problem for law enforcement, human services, and communities across the upstate region. KU County's Community Services Board, specifically its Drug and Alcohol Subcommittee, has made this issue a top item to focus on. In the studio tonight with us is KU County Undersheriff and Chair of the Drug and Alcohol Subcommittee, a nice title, by the way, James Stowell. Kevin Harris, the Executive Director of CHADD, and Ray Bazzari of the KU County Mental Health Department, where he is the Director. He's been on here several times to give us updates, but they're going to talk about opioids tonight. Welcome. Welcome back. Welcome, gentlemen. So for those who don't know, I should say, what is the Community Services Board for those who don't know, before we get too far?
Community Services Board is established by mental hygiene law that it has oversight over disability services. So people with developmental disabilities, those services, mental health, and drug and alcohol. And it has 3 subcommittees, one for each of those, and they're charged with sort of monitoring and managing and planning those systems to make sure that we take care of people. Jim's the chair of the Drug Alcohol Subcommittee, and Kevin, his agency, is one of the agencies that report to that subcommittee.
So what is your subcommittee, what's their scope of work?
Scope of work is obviously pretty self-explanatory with the alcohol and substance abuse. We have multiple agencies represented there. CHADD is one, Grace House, Drug Court, Recovery Counseling, Sheriff's Department, and community members. And
I know you have, for example, County Legislator Didio is he on your specific committee?
He is. Yes.
He is.
Yep.
So you do have some legislators there. But you also have some consumers on occasion, don't you?
Mm-hmm. Yes.
You have to. That's mandated.
That is.
Okay. For those who don't know, what's CHADD? Other than my old neighbor.
Yeah, Confidential Help for Alcohol and Drugs, Incorporated. And it's been around, easily 40 years. Okay. I've been with them 37, so that really dates me.
That dates you?
Yes.
And you're not-for-profit. You're
Yep.
located in the downtown,
yep.
in the Piccolo building.
In the Piccolo building.
What does CHADD do? What type of services do you provide?
We basically are an outpatient treatment provider for substance abuse, and we're publicly funded. We're a private not-for-profit, and we've pretty much done the bulk of the work in the community for the past 40 years as far as treatment.
So who walks in? What type of consumer walks in your door?
Mainly mandated folks.
Okay. So this is not by choice?
There are some
Okay.
who just surrender and are ready to change, but that number is small. Most people have some form of mandate,
Okay.
either a legal mandate or a family mandate or a job or a license. So
Okay.
there's always something poking them in.
And any idea how many consumers you see in a given year?
Oh, we have 275 active cases right now,
Okay.
so we probably see around 900 people a year,
Okay.
depending on in and out.
Gotcha. So we're going to kind of switch back and forth between heroin and opiates, but for those who don't know, what is an opiate?
Well, there's 2 ways to look at it. One is there is the true form of opium, which is the opium plant, and that is something that is the derivative for the heroin. Okay? The opiates that we tend to talk about, which are the pill forms, are basically synthetics, and that's by prescription only. So those are the two different ways to look at them.
Okay.
Our experience is most folks actually begin on the pill form. There's various ways in which they can inject or snort. Nobody ever starts, from my experience, with a plan to be addicted. But as far as a drug with an addictive quality, this is probably the most destructive one I've ever seen.
So why all of a sudden, where there wasn't a lot of talk, there's always been talk about people using pills and abusing them, but when we've normally heard about it, it's been about drug-resistant versions, and we're worried that we're going to have different versions of these bacteria. But this issue of opiates and the rise, why is that?
Well, from my experience, it's really a culturally based thing. There's two populations you'll see. One are folks who have legitimate pain and have been on a pain management program that got out of control. Okay, they got too much of it, got addicted, got a tolerance.
They had knee surgery, back surgery, something like that.
So that's a percentage of who we see. But the bigger percentage is the younger population that I think is very much internet connected, iPad connected. And so there's a lot of conversation about this drug and how do you use it. And then basically, as Jim was talking earlier, the big issue we see is that these folks find out that this is not as easy to get on the street anymore. So then the next step is going to heroin, which requires you to travel. And then the other part of that is heroin can be snorted and cooked, but the main thing we're starting to see is injection. And the number of young people I spoke to who said they would never inject, who we now know are injecting, has increased dramatically.
So do you know these numbers because you're getting greater arrests? How all of a sudden did you say, okay, the usage, besides those who are being assigned to Chad, how did law enforcement all of a sudden say, wow, we have a bigger problem here?
And that's a good question, because we did see a rise in arrests, but also we work closely with the hospital, the emergency rooms, and they were reporting to us as far as overdoses of prescription drugs and then heroin also. It rose dramatically over the last year and a half. And as we saw it, and we were reporting to the committee on it, we thought we got to do something. So as a committee, we have assigned different agencies that represent the committee to do different things as far as outreaching and education and awareness to the public. So
when you say overdoses are up, are we talking a couple percent? We talking giant numbers?
Oh, I would say they'd be 3- or 4-fold anyways over the last few years.
And are those overdoses, are those resulting in death often, or those are people who are surviving? Both. Okay. We just had a prescription overdose last week. Roxycontin. It's a derivative of Oxycontin. They made an arrest 2 weeks ago on a heroin dealer up in Victory. Had 90 packages of heroin. So it's out there, and we're just trying to get people to be aware of what's going on in our community, and it's here in our community, no question about it. I said at the top, I read somewhere, and I can't remember what article, and you were nice enough to send a lot of background information. Heroin kind of disappeared, it seemed. Every bad 70s drug movie was about heroin. And it was always based on what occurred out of the Golden Triangle, out of Southeast Asia, and then by the 80s it kind of disappeared. All of a sudden there's this resurgence. Is there a reason for that resurgence?
And I believe, and part of it is that it's very easily accessible, it's cheap. We're getting information from people we've arrested. They do go to a neighboring city, buy, we'll say, 10 packages of heroin for $100, $10 a packet, come back here, use 5, sell 5, and then do it all over again. Part of the problem is also, I think that with Ray mentioned it earlier, as far as the iStop, Ray, is that what it was? Yeah. As far as doctors electronically monitoring every patient that comes in to see them regarding prescription drugs, that prevented a lot of these subjects we're dealing with from shopping around and getting multiple prescriptions from multiple doctors, thus forcing them on the street to go get the heroin.
So you mentioned iStop, and that is a program where if I have a bad knee and I'm getting Oxycontin and I want to I go to you, Dr. Bizzari, you write me a prescription. I can't go to Dr. Hare and get a second prescription.
Well, physicians and pharmacists are supposed, it's a database, so
Okay.
they have access based on their license. So they're supposed to go in and check to see if the person in front of them that they're going to write for is getting multiple scripts from multiple physicians. And
And that's called doctor shopping.
that's doctor shopping.
Okay.
There's some doctors will, write and other ones won't. So I think, so Jim talked a little bit, so, nationally 4 or 5 heroin users started using prescription drugs. The reason, when you asked earlier about heroin sort of disappearing, there's a lot of prescription drug abuse. People were getting it. It was very easy to get, and it was very easy to take out of people's medicine cabinets, and so you could sort of feed an addiction that way. Now there's a lot of attention being paid to the problem, and it's sort of choking that sort of access off, and I think that's what's turning people back to using heroin, and it is cheap, and it's up 80% in the country since 2007. So those are pretty significant numbers. We should be concerned about that stuff.
So I just want to concentrate on the doctor shopping for a second, because I know your task force is also doing some outreach to the medical community. What are you trying to get the medical community to do in regards to this?
Basically, hand out information. We're going to be sending out a letter from the Board of Health. The Health Department has assisted us in drafting of a letter along with Ray, and the Board of Health is going to endorse that letter, sending out to the physicians and healthcare providers. And the information that we're going to give to them will be handed out to the patients, we hope anyways. This letter has not gone out yet, but it will be going out in the near future.
So in the Syracuse Post-Standard, either last week or the week before, there was a story about realtors being told to watch houses when you're showing houses. People are raiding medicine cabinets. So that tells me that the availability of pills is nosedive, easy access. Yes. Is that what you're finding, that now they got to get it somewhere?
Yeah, and I think one of the factors you were asking earlier about the rise, one of it, the main things we're seeing is that when it's considered a pharmaceutical and it's a prescription, a lot of people feel like there can be no damage done because a doctor has prescribed it for me. And that's one of the biggest misnomers is you have to be your consumer yourself and check whatever you're taking. And as a result, I think a lot of people dove into this, young people especially, thinking that they could take these things and there would be no consequence to it. And then that's where it blows up on them. And then, as you say, if we do our job, which I think is starting to happen, the availability of the pills are less, but it also has a consequence, and that means that folks are going to shift over to the heroin because it's easier to get and cheaper.
And New York's one of these odd states where they don't have a buyback program. You can't go to your pharmacy and say, "Here, take my pills back." Though a lot of people keep them saying, "Hey, I might need it a year and a half from now," which they often don't.
They do have the DEA, along with the Sheriff's Department and Auburn Police Department, twice a year do have a program where they can turn drugs in.
But you don't get cash for it.
You do not get cash for it.
And New York
there is
is
a drug
okay.
Turn-in program, but they don't get cash for them. No.
Okay, so if you can't go to a pharmacy, but you can go to APD and the Sheriff's Department to do this, how should people get rid of pills that they're not using? Because
what we've been told is if you contact your pharmacy, that you purchased, they will take care of it for you.
Okay. So it really does take an active step besides flushing it down a toilet, which, by the way, municipalities don't want to do because they're worried about water quality.
Because
it's this vicious circle.
One of the things that you brought up that makes sense is that clearly a lot of people are prescribed painkillers, because that's what opiates technically are. And a lot of times it's more senior folks who won't touch them. Or they take one and that's too much, and they'll put it away up in a cabinet and forgot it's even there. The young folks they can read the PDR, which is the physician's dex reference. They know exactly.
Big red book usually.
Yes, and it's got everything they need, and they'll go into a medicine cabinet and they can tell you faster than a pharmacist can what should go out of there in their pocket and out the door. And so that's why we've kind of taken it on to get that population to realize that, when medicine is not used, get rid of it. Because there are still a lot of, I think, prescriptions given to seniors that have no need to be there.
We're hoping that the doctors and the pharmacists can give people information, when they come in to pick up these scripts, like about counting your pills and securing your pills and knowing where they are and that sort of stuff, to sort of, get it so people don't have access to it. But like Kevin talked a little bit about this, I think one of the things that was kind of disturbing to us was we surveyed the schools. We had some surveys done in the schools, kids, and it talked about a lot of different things, bullying, smoking, tobacco. So that perception about because they're prescription drugs that makes them okay is pretty prevalent in schools.
It's just assumed they're safe because they have a doctor's name on them.
Yeah. Students also think that you know that it's not a bad thing to be taking pills that aren't prescribed to you. They believe that their friends or their parents wouldn't be concerned either. So there's that sort of cultural feeling about this that, you know, it's a doc thing. You can buy them, you know, at a pharmacy. So can't hurt us.
So there's also a free market issue here, dynamic here. So as opiates dry up, heroin has become now the replacement.
Replacement, yep.
And you're seeing
Drug
that
of choice.
as a greater number. And I looked at one number, one of the articles said the differential between the two, heroin costs about $10 for a small packet, while a similar amount of OxyContin is going for $80 for 80 milligrams. Is that driving people to heroin?
It is.
Okay.
Absolutely. Financially.
And just, I asked you this before, but what's 80 milligrams? What's that? That's what, 4 pills?
That's a dose like that, yeah.
Okay. And how long does something like that last for somebody who's using this stuff?
Well, somebody could shoot up one bag of heroin and it's over in about 15 minutes as far as the actual intense high, and then there's a lag time after that. So people who buy bags don't tend to just use the one.
Okay.
It tends to build on it.
And they're also getting more creative in the sense of lacing their heroin with opiates to supplement
Well,
them.
you can lace it, well, what's being laced with,
Is it propanol?
it's the painkiller there, I can't think of the name of it.
Fentanyl.
Fentanyl.
Okay.
That's the new one.
Fentanyl.
Fentanyl patches. People are pulling the drug out of the fentanyl patch and mixing it with their heroin.
So are you seeing greater, from the Sheriff's Department, I'm not asking you as the spokesman for the Sheriff's Department, but are you seeing greater efforts at interdiction, because I know there's a NARC tip line, we'll talk about that in a minute, but are you seeing a greater number of busts related to either opiates or heroin?
We're seeing more, we're seeing more arrests on opiates, and both of them actually. And I can't give you a number, but drug arrests are up. They're up.
And I thought I remember Sheriff Gould's been on from time to time, and he's always said that he always felt that drug-related crime, the crime of robberies were very highly associated with drug use.
Yeah, absolutely. Robberies, burglaries, any type of thing where they can get extra money to go out and get their drugs.
So what did the Sheriff's Department announce to the legislature on Tuesday night, this new NARC tip line? What is that? Basically,
it's a phone line they can call in, leave a message, voicemail, text message. We also got a website, qcrime.com. They can also leave messages on. It's anonymous. We work closely with the Drug Task Force because obviously that's what they do all the time, and we certainly don't want to infringe on any active investigation they're going on, but they've been very helpful with us too.
So is the tip line anonymous?
It is.
It is, okay.
It can be. I mean, we can give your name also.
Okay.
Yep.
In an article recently, it was you who had mentioned that this has become much more of a hot button issue in communities because it has moved from what we think of as junkie and a guy in an alley shooting up or with a spoon and whatever. It has now moved into the middle class and the upper middle class.
Yeah, there's no profile. There is no profile. I mean, we could not, between what he's arrested, who we treat, and who Ray sees in his mental health program, there's no way to say that it's this population. And that's the scary part about it, is it doesn't select a population, the population selects it. And this is a very popular drug. And you know, it's one of those, probably in all the years I've been at CHAD, this has probably scared me the most. Because one, the addiction quality is high and it's quick. And the other part is the withdrawal end of this is humongous. And what happens with everybody we deal with is they don't want to withdraw. They feel like they're going to die. They technically won't die from the withdrawal, they'll die from an overdose. Right. And then one of the things we're seeing locally is folks will quit for a while, then they go back and they'll try to use the same amount they used before they quit, and their tolerance isn't there, and it blows them right up, and that's usually the cause of an overdose.
How do you are there any traits that someone has that you say, okay, this person is likely a user of heroin or opiates? Is there any?
Well, I can give you 2 definitions, and they're pretty generic, but basically I think people use drugs to either maximize their pleasure or minimize their pain. Okay. So depending on which avenue you take, the sad part is the outcome is the same.
Okay.
At some point, the addiction takes over, and the reason why you did it
Doesn't
is not
matter.
there
Doesn't
anymore.
So I know you're not all about interdiction and prevention. You're also about helping people. And I won't even use the word cure because we'll get to that in a
doesn't happen.
second.
Yep.
It doesn't happen. So what is out there? What services are out there besides CHAD, but include CHAD in this,
Yep.
for people who need help, and how do they access it?
Well, there is our agency, there's Recovery Counseling. Those are the two clinics in town. We have a halfway house, which is Grace House.
And they were going to join us, and they
Yep.
unfortunately could not.
Couldn't do it. And then the new thing, and Ray and I work very closely on this, but we have a lot of folks who have dual diagnosis. And if that's the case,
Explain what a dual diagnosis
it's a
is.
mental health issue along with a substance abuse issue. And what Ray and I have worked out that works really well is we'll take on the substance abuse and work very closely with his staff to treat the mental health, because technically mental health tends to last longer treatment-wise than substance abuse does.
But we should make it clear that not everyone who has a drug abuse issue has a mental health issue,
Nope.
or vice versa.
Right.
Definitely.
Okay. Just want to clear
No,
that
you're
up.
You want to treat
Perfectly
people
fine with that.
for what's going on. right?
Okay. Obviously, in the last 2 weeks, there's been a lot of news about this. Obviously, the Hoffman death in there, and we just quickly touched on it a minute. This is an ongoing. He had an ongoing battle. He said he had kicked it for 20 years, and then recently it had come back. This is not something that you're ever not going to fight.
No.
Okay.
Because from my experience, the concept of one day at a time is really the most basic premise you can learn.
The old AA theory
Yep,
that you take one day.
AA. And what it boils down to for us is you take today, you got a good day, you go to the next day, you go to the next day. When you start projecting and thinking ahead, you can either get cocky and think you can drink or do some other drug, which will take you back to your drug of choice. Or the other thing is we tell people that you got to remind yourself where you came from, just like if you have a heart condition. You have a lifestyle change, and if you forget that you have that condition, you're going to end up with some problems.
You mentioned NA, that is Narcotics
Anonymous.
Who is that open to?
That's open to anyone who considers themselves having a problem with alcohol or
Or having a
drugs.
family member?
Or a family member. There is
Is
there's an
some-
Al-Anon for AA. There's a
Okay.
similar program for NA.
And how does somebody participate or find out about NA?
Actually, I think the Citizen prints once a week
Yeah.
all the meeting lists.
Okay.
And the only difference I would say is they'll put a 0 there, which is an open meeting, which means anybody is welcome to that meeting. If it's a C for closed, that's just for the folks who have the issue.
Okay. I wanted to make this follow up on this. Time this week had an essay by Aaron Sorkin, who went to SU, Oscar winner, wrote The West Wing. He said that in the case of Mr. Hoffman, he did not die of a heroin overdose, he died of heroin. A philosophical question, I guess, of sorts, and I'll start with you at the end. Do you agree with that thought?
Yeah, because I think basically what he was trying to state is that once you're into that cycle, then you're in trouble.
Okay.
And I think we tend to over.
There is no good amount of heroin.
No, and that's the sad part is I think you hype the traumatic event, but there are so many events that led up to that, and clearly it's the lifestyle impairment that's huge, and that one is clearly what happens to a lot of these folks.
You guys have mentioned the idea of middle school of schools in this whole mix. Do we know if this is saturated, whether it's heroin, but more so the opiates issue? Is it on college campuses? We obviously have 2 college campuses in Cuyahoga County. We have 7 or 8 high schools. I don't know what the exact number is. Are we seeing it saturate into that level?
We're seeing from the numbers that responded to the survey that there's between 6 and 11% of middle and high school kids.
So even as far down as middle school.
Middle and high school kids. We don't have anything on
Nothing on
colleges,
colleges, no.
but
But I know,
That's
looking
a
at your
chunk of
minutes,
people.
you have been looking at that issue as well.
yeah, that's a chunk of people right there.
We're planning on getting awareness out to the colleges and the high schools and through part of the committee here.
So back to your committee for a second. So we talked about a number of items that you're working on. What else is the committee itself working on?
Well, before we get into that, I'd like to say our NARC line, our guys in our drug interdiction, when they stop a car, they hand that out. There's a little saying on the back also. We've handing these out. They're down in DMV. You can get them at DMV, but it states on the back that, you know, it goes through a whole spiel of things, but the bottom line is, if you call in there, well, hopefully it'll save somebody's life. That's the bottom line.
And that is the bottom line here.
That is our goal, yeah, absolutely.
So what are you doing on the public education front?
Well, public education, we got literature. Chad has a lot of literature that's being, you know, distributed to the colleges and the high schools and BOCES. One thing that we dealt with in the past, and it wasn't that far past, was the bath salts. At one time, what, a year and a half ago, 2 years ago, that was skyrocketing. We were getting 4 or 5 complaints a week. That's just with the Sheriff's Department, on top of whatever the State Police and the Auburn Police Department were getting. And that was horrible. The reaction to bath salts was just unbelievable. Paranoia, schizophrenia, and...
Now, has that disappeared or has that declined greatly?
From Cuyahoga County,
We think it has.
it has really been amazing how we got rid of it. And I say we, the committee, the community, and everything else. And the Drug Task Force did a great job. There was one store, basically, in Auburn that was the main supplier of that.
Are they still in business or are they out of business?
They're out of business.
Okay. I only ask this because I remember talking to a police officer Labor Day weekend, or the weekend after, it was Tomato Fest weekend, and he told me about his Tuesday morning over a 3-day weekend, and he had to go to AMH. He wasn't giving me any secrets of there, but he said there were at least 12 cases that morning, and he was there for something totally different.
Exactly.
He said he was just astounded, and I think this is 2 years ago, or a year and a half ago. And so has the new fight now is back to opiates and heroin?
Absolutely. Yeah. It really is.
Other education efforts, I know you have talked about going into schools and doing some panel discussions. What else can be done?
I think that we're looking at this as a, you know, it's a public health problem. So when communities have attacked problems in a public health sort of way, you're looking at prevention, you're looking at education, you have drug enforcement, you have treatment. So you hit all of those things. So, you know, Kevin and I met with school counselors not too long ago, and they're interested in distributing information to kids and families through the school districts. We're doing this show. There's a story being done by The Citizen, and there's going to be just a lot more community outreach and you know, just try to educate people about paying attention to your kids when they get a script for pain pills. Are they taking them all? What happened afterwards? Are they okay? Talk to their doctor. Do that sort of stuff. Pay attention. Open your eyes. Talk to them.
We're a web society, an internet society. Where can people go for more information on this?
We're going to put this stuff on links on all the various agency websites and everything like that. When you're getting us right in the beginning of formulating this and pushing it out. So I would say within the next few weeks, you'll start seeing some of that stuff appear.
And there is the Human Services Coalition's website, and they have lists of agencies of items that can be used. Do any of you buy into the idea that someone, I've read this a couple of places, that this will run its course?
People have been smoking opium for 12 centuries.
Years.
Yeah. I think that, like Kevin said, I mean, folks are always looking for ways, you know.
We're hoping to make a dent in it. That's obviously why we're here, and we appreciate you letting us come on.
Great to have you
Absolutely.
here. We do want to thank all three. We've had Kevin Hares, the Executive Director of CHAD, as well as Cuyahoga County Undersheriff and Chair of the Drug and Alcohol Subcommittee, Jim Stowell, as well as Ray Bizzari, Cuyahoga County's Mental Health Director, to discuss the rise in the use of opiates and heroin locally. They did mention, and I would give a plug out, Samantha House of the Citizen will have a piece on Sunday about, at least it's planned for Sunday, on the rise in our community, and we encourage people, if you want to hear more about this subject, either read about that in the Citizen or also go online to their websites. We'll be back on Tuesday with City Manager Doug Selby, and we'll be in the studio to give us a city update. Might talk about some of the construction that's going around in Auburn, deliberate or not deliberate. In the future weeks, we'll have School Superintendent Constance Evelyn in, Cuyahoga County Legislative Chairman Michael Chapman, Congressman Dan Maffei, and County Administrator Suzanne Sinclair have all been confirmed with us, and we'll bring them to you over the next month. Before we go, though, we would like to let you know that you can send us your thoughts and questions by contacting us at Inside Government, P.O. Box 839, Auburn, New York, or at COZGUYTHO@AOL.com. I'm Guy Cosentino for Cuyahoga Community College. I want to thank you for watching. I hope you have a great evening and a great tomorrow. Thank you. And you're still on We Cover Everything?